30 years ago, I sustained an injury in the right knee playing badminton. The knee continued to give pain, and I was still concerned, and I started to limp. I was starting to get more stiffness in the knee, and it got to a point where I was becoming incapacitated. Not totally, but partially incapacitated.
When I first met Mr. Herbert, I met him a few months ago in my clinic. He's found life difficult in the last couple of years as his knee has become gradually more and more painful with osteoarthritis. And when we saw him, we discussed various options. We initially tried some conservative treatments, but unfortunately it wasn't going to be, and it came to the point Mr. Herbert asked me about knee replacement surgery, and he particularly asked me about what were the new advances and what were the things that we could offer in knee replacement surgery. And I thought he would be an ideal candidate for Mako robot-assisted knee replacement surgery.
He said, "You're bone on bone, and it can't get any better. You can live with what you have, but you're bone on bone." So as soon as he said that, we knew that a decision was imminent.
He didn't want to wait for 6 to 12 months. He didn't want an extended rehabilitation time, and what he needed was one operation which gets him back on his feet quickly, back into activities and moving on with his life, which is what I hope we would be able to achieve for him. So when we spoke about the Mako robot, he did his own research, he looked into it, and we discussed it again, and he was very keen to get on and have his procedure performed in this way.
The fact that you come into a hospital with your own room and so on and so forth, and the fact that you've got one-to-one attention from the nursing staff, and then the recovery time is potentially speeded up. Yes, all of those things influence the decision. The CT scan and the process and the staff, the reception et al. Were great. The operation experience was apparently a couple of hours. I came out 2 hours. 2 hours later, and 20 minutes after that I woke up, moved back to the ward, and then the caring process, the afterwards bit started. So it was superb.
It's been an absolute pleasure looking after Mr. Herbert. He's so motivated and he's so keen to get moving and get back into his activities. From day one, he was up and about, bending his knee, and he's just been enjoying life again. When we've seen him in clinic, he's already getting out and about. He's enjoying some walks and getting back into his activities, and he can really see where this is going and where it's likely to end up for him.